Thank you, Dr. Wolf, for that kind introduction and for your leadership with the Centers for Disease Control and Prevention. In North Dakota, the CDC is a continual source of data, research, and valuable information that helps us inform our stakeholders, agencies, and policymakers on the various health challenges that we face. The Governor and I thank you for the critical role you play in the broader fight against the opioid crisis and the disease of addiction. The CDC has a great tagline, CDC 24/7, saving lives, protecting people, and has been a leader in sharing reports and analyzing stigma and attitudes towards various health issues and diseases such as HIV/AIDS, leprosy, also known as Hansen's disease, and mental health. I was so pleased and super excited to see the valuable and important information on the CDC website regarding stigma and discrimination associated with HIV/AIDS. I believe there's a real opportunity for the CDC to take a leadership role in pioneering critical outreach and communication needed to eliminate the stigma and discrimination for those who struggle with a chronic disease of addiction. The CDC can offer solutions to communities, states, and the federal government, which would help reduce the social barriers to care and empower more people toward recovery and ultimately save lives. Thank you to the Cross-Border Health Foundation for inviting me to be with you today, and for the proactive work you continue to do around the issues of the opioid crisis and addiction here in the United States and Canada. Thank you to the event organizers, Cross-Border Health Foundation, World Health Innovation Network, and the Council of the Great Lakes region, and all who worked hard to make this event a reality. To Pew Charitable Trust, thank you for being host to today's event. And most of all, thank you to everyone in this room, the medical community, behavioral health, law enforcement, government leaders, and others from the United States and Canada who get up every day ready to inspire action, create change in communities, and transform the lives of citizens across our two great countries. Well, there are two things I never thought I would ever do. And one is be First Lady of North Dakota. And two is have the opportunity to share my story to a room full of the most impassioned leaders committed to saving lives and communities. But by some crazy set of circumstances, or maybe by divine intervention, I'm both First Lady and I'm standing in front of you today full of gratitude for the opportunity to be here. The chronic disease of addiction, including the opioid crisis, is one of the biggest challenges facing our nation. The lethality and highly addictive nature of opioids has brought a focus on the disease of addiction, which frankly is long overdue. According to the CDC, between 1999 and 2016, more than 350,000 people died in the U.S. from overdoses related to opioids. I don't pretend to be an expert on the disease of addiction, but I do have lived experience. I've been in recovery from alcohol addiction for over 16 years. I spent 15 of those years in silence, keeping my recovery in the closet like a shameful secret. Sadly, only 1 in 10 people who need treatment for addiction actually seek treatment. I know because I was one of those statistics. I knew for years that I needed help, but I didn't seek it because I was ashamed. For people with the disease of addiction, 3 words have deprived them of medical treatment, empathy, and compassion for decades, or more like centuries. And those 3 words are shame, stigma, and discrimination. My journey with addiction started when I was in high school in North Dakota when I first started drinking. I knew as a teenager that I didn't drink like others. I experienced my first blackout when I was in high school. I struggled with alcohol-related issues and episodes over the next 20 years of my life. I chose to live and work in cultures with excessive drinking. I had no desire to attend events without alcohol, and I could not imagine my life without alcohol. While constantly struggling with my addiction, my career progressed, and I had forward movement in my life, but I could never reach my full potential with my addiction holding me back. There came a time when I knew I needed to stop drinking, but addiction's a powerful disease, and it kept me drinking for many years. I could achieve any goal I set for myself, but I could not stop drinking, even though I experienced many baffling, defeating, and demoralizing drunk episodes. I'd stop drinking for 3 months, and then I'd start again. I'd stop for a year, and then I'd start again. And this cycle continued over a period of 8 years. I'm so grateful that my higher power kept asking me to pull on my boots and try again. I finally became willing to do whatever it would take to stay sober. And when I became completely willing, that's when the miracle happened for me and I started staying sober. I found a program that's built on a foundation of gratitude, helping others, and a higher power, and it saved my life. I'll forever be grateful to this program and its people for embracing me and helping me find recovery. My openness about my recovery has started what I hope will be a lifetime of advocacy, speaking out for those who have been misrepresented and misunderstood, and creating opportunities for people, families, and communities devastated by this disease. As First Lady, it's my ultimate mission to end the shame and stigma of the disease of addiction. Stigma, which is defined as the mark of disgrace, is a persistent barrier to effectively confronting addiction and finding recovery. Stigma and the accompanying discrimination affects the emotional well-being of those with the disease of addiction. People internalize that stigma, and they fear that they will be judged negatively. Internalized stigma can lead to feelings of shame, isolation, and despair, all of which prevent people from talking about their disease and reaching out for help. With addiction, stigma puts up walls instead of building bridges. It is socially constructed, based in fear, and is often accompanied by a lack of accurate information. I met the parents of a teenage boy who died of an opioid overdose in his car in a high school parking lot. They were devastated by their son's needless death. However, there was no outpouring of community support like there would be for a teenager who died of cancer or of a car accident. Shame and stigma keep people away. I believe addiction needs to be embraced like any other chronic, progressively fatal disease before real changes can be made in our communities and before the shame and stigma can be eliminated. Addiction is not a choice, and it is not a character flaw, and it does not discriminate. The stigma of addiction started way back in the 1930s when scientists began studying addictive behavior because people addicted to drugs and alcohol were thought to be morally flawed. Those views shaped society's response to addiction, treating it as a moral failing rather than a health problem, which led to an emphasis on punishment rather than prevention and treatment. Alcohol addiction was declared a disease by the American Medical Association way back in 1954. There's a new book out about Betty Ford titled Betty Ford, First Lady, Women's Advocate, Survivor, Trailblazer. Betty Ford was the First Lady of the United States who spoke openly about her addiction to drugs and alcohol. This is a 1978 quote from the book. What she, Betty Ford, has done is the most significant advance in the history of alcohol treatment, said Dr. Luther Cloud, president of the National Council on Alcoholism. This might well mark the end of the stigma. That was 40 years ago, and the stigma still keeps people from talking about their disease, from speaking out, and seeking help. And addiction is still viewed by many as a lack of willpower or a character flaw, and is disappointingly still approached with punishment in many communities. The punishment approach brings with it a powerful shame and stigma that influences our laws, healthcare, research, and support for people with the disease of addiction. Now we must be driven by data and facts and recognize the science behind the chronic brain disease of addiction. Scientists, physicians, and even the Surgeon General agree that addiction is a disease. When people have the chronic brain disease of addiction, their brain gets hijacked in a biological way, manipulating dopamine levels to tell the person that the highest priority in their life is the disease of addiction, and the only choices are drugs or alcohol. When it comes to opioid addiction, for many it starts when they are teenagers or adults, with a doctor's or a dentist's prescription for pain medicine. My niece was an all-state hockey goalie in high school. Because of a hand injury in her early teens, she was given prescription pain medicine. She had several more injuries throughout her high school hockey career and was prescribed pain medicine for all. Unbeknownst to me and her family, she became addicted to opioids. She's now 23 and in recovery from her opioid addiction. It's hard for people to accept the concept that addiction is a disease. I know how hard it is because I didn't believe it myself. I thought I could do the right thing. I thought I could make the right choices. But after relapsing for 8 years and literally thinking that I must be insane, I now understand. No one would choose that life. No one chooses to die from drug overdoses or to lose everything in their life because of meth or to die from years of addiction to alcohol. With compassion, we need true understanding. And sometimes that understanding comes from the humility and courage to unlearn the things that we have held as truths for our entire lives. A universal acceptance of addiction as a disease across our nation will save lives and provide futures for our next generation of leaders and innovators and eliminate the stigma of addiction. There are countless examples of people I've met since I've become First Lady and started sharing my story, who've told me about their recovery or their long-term sobriety, who would like to help in any way possible, as long as it's on the down low or behind the scenes. They're worried about the ramifications and stigma, and I always respond to them, when you no longer have to worry about your job or your reputation or your income because of the stigma of the disease of addiction, we will have won the war. Now, it may come as a surprise to you, but there's actually a really simple solution to eliminating the stigma of addiction. A solution where everyone across our nation can participate. The simple solution is talk. Those in recovery sharing their stories. Caregivers talking about those that they are helping or are struggling with the disease of addiction. Those in public service talking about addiction and recovery. And corporations creating safe environments for people to talk about addiction and recovery at work. Talk will eliminate the elephant in the room and normalize the conversation around addiction. If we do this, the stigma will be eliminated, more people will seek treatment and find recovery, and everyone who is talking about addiction will be saving lives. This is a grassroots movement that costs nothing, doesn't need any legislation, and could easily be the one thing that crosses political party lines to unify and truly make a difference for our nation. The opioid crisis has brought addiction to the forefront. While the focus revolves around opioids, addiction is a constant, no matter the substance. The evolving crisis needs to be met with a holistic, adaptive response, especially in our healthcare system, that focuses on the disease of addiction rather than creating systems and processes for one specific drug, opioids. My niece that I mentioned earlier had hip surgery a few months ago. She and her surgeon worked on a plan ahead of time for her not to receive any opioid pain medication during or after the surgery. But because there weren't any protocols, systems, processes, or standard operating procedures at that hospital for treating someone with the chronic disease of addiction, none of what they planned ahead of time was implemented during the surgery. She was in excruciating pain after the surgery because she did not receive any of the planned pain blockers and was given fentanyl for the pain. Prior to being released from the hospital, she was offered a prescription for 50 Oxycontin. Instead of protecting her, the protocol was to put her back on the same miserable road she'd been on when she was in full-blown active addiction. She had a year of recovery before the surgery and thankfully is still in recovery after the surgery. So in the U.S., we need a holistic approach to the chronic disease of addiction in our healthcare system. North Dakota shares a 310-mile border with Canada. We are truly next-door neighbors. I spent many summers when I was growing up fishing for northern pike and walleye at Lake of the Woods in Canada. My grandfather and father have been going to Flin Flon, some of you may know where that is, and fishing Amiska Lake since I was a baby. In my time as First Lady, I've had the honor of meeting Prime Minister Trudeau and have heard him speak about the devastation of the opioid crisis in Canada. I'm impressed with Canada's strategic approach to the opioid crisis, including providing important information about stigma. In North Dakota, we are focusing on several innovative initiatives to combat the disease of addiction and reinvent recovery. We're a small state of caring and committed people. We hope to serve as a leader and an example in the United States and maybe Canada on how to effectively sustain a system of holistic wraparound care for the disease of addiction and eliminate stigma. We're using evidence-based methods to create a system to measure our progress on eliminating stigma. In collaboration with our behavioral health team and the Addiction Policy Forum here in DC, we completed a first-of-its-kind addiction stigma survey to measure the baseline of stigma in our state. This type of survey solely focused on stigma has not occurred in any other state. We are the first. The results will help us shape the direction and strategy to reduce social barriers moving forward. In our advocacy work as a state, we continue to emphasize that addiction does not discriminate and can happen to anyone. Our stigma survey showed that 60% of the people that responded have been impacted by addiction, validating that it touches all families, businesses, and communities regardless of ethnicity, gender, age, or socioeconomic status. The statistic that 1 in 3 in our state still believe that addiction is a choice or moral failing shows that we have work to do. The stigma survey included all populations in our state, including Native Americans. The Native American population is one of the hardest hit by addiction in North Dakota. Meth and alcohol have devastated families. The governor and I both have initiatives around partnering with Native Americans to address the chronic disease of addiction on the reservations. We believe that we can't reach our full potential as a state unless all of our citizens have the opportunity to reach their full potential. And while sovereign nations, the people enrolled in tribes in North Dakota are also North Dakota people. So future survey data will show if we're moving the needle on eliminating stigma. Data helps drive funding. Data can change minds and create systems to ultimately save lives. 80% of those incarcerated in North Dakota have an addiction. They need treatment and not incarceration. During the last 30 years, it was thought that more punishment would mean less addiction. Those with the disease of addiction who are convicted of nonviolent, possession-related crimes carry the extra burden and stigma of being a felon when they are released from prison. And they often receive no treatment for their disease while incarcerated. After doing their time and paying for their crimes, felons can't find jobs. They can't find places to live. The felony discrimination towards the disease of addiction perpetuates the cycle of addiction. Through an innovative program in North Dakota called Free Through Recovery, we are giving those dealing with substance abuse who become entangled in our legal system the opportunity to recover successfully in their communities with support from care coordinators and peer support specialists. And reimbursement for the Free Through Recovery program is outcome-based, with opportunities for incentive funding for meeting performance benchmarks. This reimbursement model is innovative and unprecedented. The model pays for wellness and recovery. And this program is working. Goals are being achieved, incentives are being paid, and active revocation and absconding rates are decreasing in North Dakota. As we build recovery support for the citizens of our state, this is the model that we would like to roll out to our communities outside of the criminal justice system. We see the peer support model as the opportunity to create support for those struggling with addiction in our rural communities. We are also enlisting the help of the faith-based community in our state to become recovery community centers, especially in our rural areas. Building recovery support in communities builds bridges that can bridge that critical gap between treatment and recovery when people are at the highest risk of relapse. In supporting those at risk of re-entering the criminal justice system, we understand that a critical component of that is creating stability in people's lives and giving them purpose and dignity through employment. In North Dakota, we are advocates for policies such as Ban the Box, which removes questions regarding criminal history in the initial stages of the interview process. Background and criminal checks are then completed at the end of the hiring process, giving qualified candidates a fighting chance to prove their merit and share their circumstances behind their criminal history, particularly if it was influenced by addiction. And more importantly, we need employers who are champions for recovery. In North Dakota, we have a large utility company that is a leader in supporting their employees who are struggling with the disease of addiction, providing support for them to receive treatment and find recovery. At this company, employees deal with heavy machinery, electrical components, and other potentially dangerous utilities. But if an employee is suffering from an addiction, they may simply move to a different department while they are in treatment so they can maintain their job, but also maintain safety parameters for the employees around them. When the employee is in recovery for a demonstrated period of time, they can move back to their prior job. And this strategy has been described as a win-win scenario. Employee wins because it removes significant barriers and that they aren't concerned about losing their job or housing. They can maintain their stability, which is critical to successful recovery. And the employer wins because it's more cost-effective to retain existing employees than it is to recruit new ones. And really, the bottom line is it's the right thing to do. So to close, I'm so grateful and honored to Cross Border Health Foundation for inviting me to be with you today. I encourage all of you participating in policy development around the disease of addiction at both the federal and state levels in U.S. and Canada to include people in recovery. They can help create messaging and shape policy that can truly make a difference. Bring those with lived experience to the table to show what recovery looks like and help provide hope for the future. Now is the time to mobilize social movements to eliminate the stigma of addiction. Capitalize on the focus of inclusion and acceptance of diversity. It is time to put aside stereotypes, to put aside intolerance. Now is the time to come together to help those suffering from the disease of addiction. Now is the time for every one of us in our own lives, in our own work, and in our communities to take action. There is no shame in addiction, and there's so much hope and possibility in recovery. I'm like 23 million other people across our great nation who have the disease of addiction, and I am a face and voice of recovery. Thank you.